It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units whilst providing quality services for long-term ventilated patients and medically complex patients at home. In last week's blog I talked about, should my dad go home with intensive care at home? Should he stay in ICU or go to LTAC live stream? You can check out last week's blog and live stream by clicking on the link below this video. In today's blog post and video, we want to elaborate on the ABC article from earlier in 2021. Queensland mum with motor neuron disease denied life-prolonging surgery. Now, for anyone that doesn't know what life-prolonging surgery means in a situation where a patient has motor neuron disease, it quite frankly refers to a tracheostomy or tracheostomy. And a tracheostomy for a motor neuron disease patient simply is life-prolonging. Now, the most prominent figure that everybody knows is Professor Stephen Hawking, that lived with motor neuron disease for decades with the tracheostomy, and he had much to contribute to society, much to contribute to science, and he lived a very good quality of life, I think, until his mid-70s, until he passed away a few years ago. Now, here at Intensive Care at Home, we are looking after clients at home with motor neuron disease as well, and some of those clients have a very good quality of life. They also contribute to their family's life, they contribute to science, they contribute to some of their employers, and they live an incredible quality of life because of the life-saving surgery that's being referred to in this ABC article, hence the tracheostomy. Now, who is anyone in this world to say who should have a tracheostomy and who shouldn't? This is up to the individual to make that choice, because in this day and age, with our service Intensive Care at Home, patients or clients don't need to live in intensive care, and they don't need to die either. They can have a tracheostomy even if they stay on the ventilator for the rest of their lives, and they can go home with services like Intensive Care at Home, and it's up to the individual to make that choice. And again, it's not up to intensive care professionals or anyone, because the services like ours are here. The choice is all within the consumer. And the funding is there as well, especially here in Australia with the National Disability Insurance Scheme, the NDIS, but also other funding schemes. But also hospitals can pay for it too, because it saves half of the cost of an intensive care bed if hospitals do the tracheostomy, get patients out of intensive care quicker instead of letting patients die. End of life is a choice that people need to make themselves, and it's not based on perceived resources. The resources are there, and it's up to the individual again to use intensive care at home and go home instead of staying in intensive care with the tracheostomy if they have motor neuron disease. So I'll read out the article I want to share from the ABC News posted on the 18th of August 2021, where it says Queensland mum with motor neuron disease denied life-prolonging surgery. Queensland mother Gabrielle Watkins says she has been denied life-prolonging surgery in her fight to live with motor neuron disease. Day by day, her lungs are weakening, so the 53-year-old Mrs. Watkins becomes more reliant on an oxygen mask to breathe. But a tracheostomy, she said, would allow her to breathe and live for longer through the tube inserted into her neck, her trachea. They're taking away the right to extend my life, Mrs. Watkins said. Each day my lung capacity is reducing and my body's ability to handle the life-prolonging surgery is decreasing. Mrs. Watkins said the tracheostomy would also mean she could use her eye-gazing technology to communicate. Currently, she cannot wear her glasses with non-invasive ventilation such as BiPAP, which stops her from speaking, emailing, using the internet, reading books, and staying connected with her friends and family. In a statement, the chief executive of the Central Queensland Hospital and Health Service, Steve Williamson, said there was currently little evidence in Australia to suggest the clinical benefits would outweigh the risks of the procedure. Excuse me, Mr. Williamson, with all due respect, we are looking after many tracheostomy and ventilated clients at home and have been doing so for many years, for a decade now, and similar services have been around in Europe for the last 25 years. So Mr. Williamson, I don't know the world you are living in, but there is a different world out there with benefits for patients, families, but also for hospitals. And Mr. Williamson, you need to open your eyes what's happening in the real world out there. Mr. Williamson continues, these are very complex cases that are decided around individual circumstances. I cannot provide comment on other cases around Australia, Mr. Williamson said. My first reaction was disbelief, then I was distraught, Mrs. Watkins said. Essentially, they've handed me a death sentence. My 5 sisters have moved to Queensland to be near me to support me, but the irony is that I probably should have moved to Victoria. Maybe I would have been able to access a medical team that would accept my decision to choose to want to go on living. Motor neuron disease, MND, is a progressive and terminal disease that attacks the nerves in the brain and spinal cord, with respiratory muscle weakness occurring eventually in everyone with the disease. There is no known cause or cure. And I agree that Mrs. Watkins should probably move to Queensland because we are, move to Victoria because we are in Victoria, even though we have clients in Queensland as well. I don't think it's dependent on the state here in Australia where you get a tracheostomy. I think you'll get a tracheostomy anywhere. It just comes down to the right advocacy, really. There is no known cause or cure for MND. While tracheostomies are not widely performed in Australia for people with MND, it has been done in some cases, but is performed more regularly in countries such as Japan, but also in Europe. Renowned physicist Professor Stephen Hawking underwent the procedure in 1985, and it kept him alive for 33 years. The average life expectancy after diagnosis, however, is 1 to 5 years. Victorian doctor Ian Haywood has MND and underwent a tracheostomy after developing pneumonia, and Mr. Haywood is one of our clients here at Intensive Care at Home. He said he faced initial hesitation from medical staff who wanted to refer him to palliative care, but his wife pushed for the surgery, and an ICU doctor who attended the same medical school as Dr. Haywood performed the procedure. I don't know how difficult it would have been without my advantages like private health insurance and lots of health industry contacts. But I'm concerned it would have been a lot harder, Dr. Haywood says. Having that extra time with family meant a great deal to me and my family. Our son was 4 when I was diagnosed in 2016, and I'm so grateful to continue to be part of his life. Dr. Haywood said the case against Mrs. Watkin appeared manifestly unfair. It seems to be a state-based medical lottery, Mr. Haywood said. The Central Queensland Hospital and Health Service said it had and would continue to do everything it could to work with Mrs. Watkin and her family to determine her ongoing needs and plan of care. Central Queensland Hospital and Health Services sympathises with Mrs. Watkin and her family, and we understand they are working through a very difficult and debilitating diagnosis, Mr. Williamson said. He said a team that included specialists in intensive care, respiratory medicine, palliative care and clinical ethics considered Mrs. Watkins' requests over a number of meetings. Well, here is what I have to say again to Mr. Williamson and Central Queensland Hospital. You need to open your eyes of what's happening in the real world. You need to open your eyes of what's happening in the community in 2022. This is not 1980 anymore. You need to open your eyes that healthcare services have progressed, have innovated. I believe the only place that hasn't innovated might be Central Queensland Hospital. Despite the decision, Mrs. Watkins hoped Queensland Health would reconsider. M&D Queensland confirmed that there were surgeons who are willing to do the procedure in New South Wales, but they were unable to take referrals from outside their own regions. Listen, in this day and age, a tracheostomy can be performed at the bedside in ICU. It's performed in 45 to 60 minutes, sometimes even less. So there's no need for Mrs. Watkins to go to another state. That's complete and utter nonsense. Most tracheostomies can be done in intensive care at the bedside. Mrs. Watkins said she was also considering moving from Central Queensland to Brisbane to pursue private treatment, and said there was a private surgeon who was willing to perform the procedure. She considered her life to be bloody good and had already had a percutaneous endoscopic gastrostomy, a PEG surgery to feed, and saw the tracheostomy as the next and final step to prolong her life. The surgery will mean I will get to keep on living my life and hopefully be here to become a grandmother soon, she said. There's a big hint to my sons. So I've also posted a link to the article and I posted some references here as well. Now, if you have a loved one in intensive care and you want to go home with our intensive care at home service, and if you want to find out how to get funding for our service and how it all works, please contact us on one of the numbers on the top of our website, or simply send me an email to info@intensivecareathome.com. That's info@intensivecareathome.com, or call us on one of the numbers on the top of our website at intensivecareathome.com. Please also have a look at our case studies on our website and at our service section, and there we highlight more about how we can look after ventilated clients at home. And if you're at home already and you need to support for your critically ill loved one at home, and if you have insufficient support or insufficient funding, or if you need an NDIS specialist support coordinator for your complex needs or for your family's complex needs, please contact us as well. We can help you with all of that. And last but not least, if you are an intensive care nurse or a pediatric intensive care nurse with a minimum of 2 years ICU or pediatric ICU experience, and you ideally have a critical care certificate, please contact us as well. Check out our career section on our website. We are currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area, northern suburbs, Mornington Peninsula, Frankston area, South Gippsland, as well as Wollongong in New South Wales. We are also an NDIS, TAC and DVA approved community service provider in Australia. Have a look at our range of full service provisions. We have also been part of the Royal Melbourne Health Accelerator program in the past for innovative healthcare companies. Thank you for watching this video, and thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll talk to you next week. Take care.